Today I'm going to show you how we do Rebecca's chemotherapy at home through a cadd pump. My husband Paul, who kindly volunteered me for this, has at the last minute decided to go on a brewery tour with some friends. So on my own today. It's the 5th day of Rebecca's chemotherapy of us doing this, so I'm going to try my best to do it on my own. Now the alternative to this would be Rebecca having her chemotherapy at the treatment hospital, which is an hour's drive away, and it would mean us going to the day unit. They would administer it through an IV drip, and it would possibly take, sometimes we can sit there all day waiting for our turn as different cases come in and out, and then the treatment itself would probably take about 2.5 hours, and then we would need to drive home. The flexibility of this means that we can go to work, Rebecca can be at home in her bed and be comfortable, so it makes it much easier and just saves us so much time. So the first thing we would have to do is wash our hands and apply non-sterile gloves, which I've already done. I've already cleaned the trays and I've air dried them, and I've got 2 separate trays. And one of them I'm going to put all the things for the cadd pump, and then the other tray I'm going to put all the things that I use to flush Rebecca's line. So the first thing we would do is open up the giving set for Rebecca's chemotherapy to run through, and this is attaching to a Hickman line. So we'll tip that out without touching it, and then inside there is the part that attaches to the cassette. One end of it has a spike on that I'm going to spike the chemotherapy bag with. The other end has a cover on it at the moment, but it will attach to Rebecca's chemotherapy line with a twist and lock. It's got a filter on it, that's to try and help with the air bubbles, and then there's a clamp here that I have to click shut before we start. So I'll do that. Then I have to get Rebecca's chemotherapy out of the fridge. I have to check that it's in date, which I've done already. And then inside there is another bag that I have to check whether there's any signs of any leaks, which there's not. Check the dates again and the details. I take all of that out. And then there are 2 ends to it. I have to lay this flat in the tray before I twist this off to avoid chemotherapy splashing in my eye. So I have to twist this off in a second, and then I have to spike it with this end. Okay, so I'm going to do that now. So I've twisted the blue cap off. I take the spiking component out, push it in, and at that point I have to give it a little bit of a shake and a bit of a flick just to get any air bubbles out. And what we found for Rebecca, because we don't have a drip stand at home, we are currently using her NG feeding stand, and we've put a hook on it, which means that I can then hang this up and use it as like a mini drip stand next to her bed. So I normally give it another little flick just to make sure all the air bubbles are out, and then stand that up to the side. And then what needs to happen next is I get the cadd pump, which looks like that. And what I have to do is to, before I do that part, I need to take off the blue clip that's on the wire from the chemotherapy so that it's ready. And then I press the button on the side of the cadd pump. The screen will then power on. I don't know how well this will show actually. And then once it's on, it gives you lots of information on the screen. Now, from yesterday, it's remembered some of the dose from her flush, so in a second that'll clear off. Now, what we do is we would lie it flat. Actually, I don't need to lie it flat. There's some little hooks on the end of here that you have to hook into the chemotherapy pump, and then I have to pull the latch down and click it into position, and then I have to slide that back up so that now, just flick that over so it's not in a tangle, that's now attached to the bottom of there. And then what would happen is it normally asks me if I want to reset the reservoir volume to however much is attached because it's detected the bag, and I would click yes. It saves those settings and it'll ask me if I want to prime the tubing, and so I would say yes. And then it'll tell me, gives you step-by-step instructions, so it's really clever. It tells me to disconnect the tubing from the patient. It's not attached to Rebecca at the moment. Open the clamps, and then I have to press prime. So I'm unclipping that clip I did from earlier on, and I'm taking the end off here. And at this point, I have to drip it over the tray or the sink, and then wash it away. So I am clicking prime on the cadd pump, and what slowly happens is the liquid fills through the wire, and what I'm watching for is it coming through to the filter. You won't be able to see it on here, but it fills through really slowly, and when it gets to the top I have to watch for it being almost at the top. When it starts to do the first drop out, I have to click stop priming on the pump. So at the minute it's at about 2 mils. On these particular wires it's about 3.5 that it normally stops at, but they can be different sizes. So I am going to click stop in a second, and then I have to clamp again. And I normally do this closer to the filter, and then I need to put it down on the tray. At that point, the pump will say, do you want to continue priming? And I've got a choice of yes or no, so I'm going to say no. It'll say, do you want to start the pump? And I'm going to not do anything at that point. I'm just going to leave it because we're not ready yet. That's that part set up, and that's all I can do with the non-sterile gloves on. And I've now got to set up to flush Rebecca before and afterwards of doing the chemotherapy. So I'm going to take these gloves off. I have to wash and dry my hands. So I shall do that really quickly. And then once I've done that, I have to get all the equipment out that we need to do the flush with. And I have to empty them out onto the tray. Now normally it would be 3 syringes I would be emptying onto the tray, because it would be 1 I'm going to fill full of saline to flush Rebecca before I give the chemotherapy. 1 would be for when she's finished, and she's finished her flush of saline, which you'll see in a second. This would be the last step. I would do this, and then I would do heparin, which locks the line. It's like a blood thinner. So I would empty all of those out onto the tray without touching them. So trying to get into the packet is a feat in itself. And then today, because it's Rebecca's last day, I also need to flush. She's got a double treatment, so I actually need to set up 2 more syringes so that I can put some saline and heparin into a other line. And I also have to change a line lengths today, because it will have been all the chemotherapy done until Monday when we go back to the hospital. At the moment it's VIT chemotherapy Rebecca's having, so on Monday they'll be giving her a syringe, a bit bigger than this really, of a dose of vincristine, which is for Rebecca's height and weight and age. And then she has that on day 1 and day 8. On day 1 to 5 she also takes some temozolomide. capsules every day. She started on 135 milligrams and now we're down to 120, so she's glad because she's gone from 5 capsules down to 2 at the minute, so that's less things to take. At the moment I am opening up the needles and needle ends and I am putting those onto the tray. And then I know today I'm going to change the line ends of Rebecca's Hickman line, so I'm going to put some of those in the tray as well. Because I'm not using some of these syringes till the end of Rebecca's chemotherapy, which will take about an hour and a half, we use these small bungs to keep the contents of the syringe sterile, really. So I'm going to empty out 4 of those I need. Just need to grab one more. Put that in the tray as well. We need some sterile wipes to clean Rebecca's Hickman line before we access it. And at the moment I'm only going to open one of those out because if I open these now they would dry out before we need them. So I put those onto a separate little tray that I've got there. Into that tray for later as well, I'm also going to put the saline flush. So this is after Rebecca's chemotherapy has run through that line. There's always a little bit left in the part between the pump and the wire to Rebecca. So it's to flush that very last little bit down so that she gets the full 50 mils it is that Rebecca's on at the moment. So I have to swap the spike later on between the chemotherapy bag for this when it alarms. And then for flushing Rebecca's line, I need some of this saline, so I would put ones for before, ones for afterwards, and ones for the other part of a Hickman line today. So I have to twist all the caps off of those. And I'm using one part of this tray as my clean area, one part as, they would call it the dirty part of it. And then I've got some little glass vials of heparin, which is the blood thinner that we lock the line with at the end. So there's one for each line. Put those in. I can't open those yet until I've got gloves on. And then I think we're good to go. The only other thing that I have to have are double packed gloves. So I have a pair that I need to use at the end. I've also got just a box of non-sterile gloves and I have to use those when I swap from chemotherapy to the bottle of flush later on. So I shall do that. And then the pair of gloves that I'm going to open now will be the ones that I'm going to use when I set this up and attach it to Rebecca. Because Paul's not here, he normally carries the trays at this point, I'll have to do a third pair of gloves when I get upstairs, just so that I'm touching Rebecca's lines with absolutely clean gloves that haven't touched anything else. And at this point, I have to put gel on my hands. Dry. Okay. So I have to put the needle ends on all of the syringes. Normally this would be 3 because it's last day of chemotherapy today, that's 5. I find it handy to have the bin near me so that I can put all the things in straight away, and I have got a sharps bin in front of me as well, just to put all the needles in a moment. And then the next thing I need to do is to clean the glass vials of heparin, and what I do with those is they have to give them a good clean round the neck, and there is a little small dot which tells you where to snap and break it, and you have to be careful when you do this that you don't cut your thumb. It's easily done. So snap the end off, put it in the sharps bin, put it back on my tray stood up, and then I have to do the same with the second one using a different part of the wipe. We used to do separate wipes for this, but we're all about saving resources now for the NHS, they've said. So, got all of those, and then at that point what I have to do is put the end of the needle into the bottle, and I have to flick it back. I'll try and draw it back a little bit so you can see, and then I just have to pull it up till it pulls all the liquid, and you can normally hear because it makes that funny noise at the end. And then I would put that in the sharps bin, and what you have to do is go over to the sink, and then you can probably see the liquid moving up the syringe. When I get near to the top, I just have to drip a little bit out of the end and then take the end off. So quickly do that with the others. And some people at this point would have their double pack gloves on, but you can do it as long as your hands have been cleaned. So now what I'm doing are the 3 bottles of saline liquid, 1 in each syringe. And because they're not glass, they can just go in the bin. Last one of those. Right, the machine's just beeping to make sure I know it's still switched on, but that's okay. So what I end up with by the end of that is 3 syringes of liquid, 2 of heparin, and I know the difference because this has only got about 5 mils in, these are 10. And then what I'm going to do is the one that I'm going to use now to flush Rebecca's line and just make sure that everything's flowing like it should be before I put the chemotherapy through it, I leave without anything on it. But the others, I have to put a lid onto each one, of the bung on the end of each one, so it looks like that. And then that just seals it into the tube for later. And then the only other thing I've now got in that tray is the line ends that I showed you earlier on. Without it tipping over. This is why Paul should have been here. So, I think we're good to go. I've realised I'm 1 wipe short, so I'm just going to pop that in. And then I'm just going to gel my hands 1 more time. Before I put the double pack gloves on. And then what happens is the gloves are folded over at the top so that you can only touch, you're meant to wiggle your hands into them and it's really difficult, but when you watch the nurses, what they do is as long as your hand only touches the inside of the glove, that's okay. So I'm pulling that on. Where it's folded over, I've still got hold of the inside of the glove. Then I grab the outside bit of the glove, pull it by the cuff, and pull that one on. When I've got that one on, I can then straighten that one up. And then I'm good to go. And what I will do in the next part, but I'm going to have to stop the video so that I can go and do the next bit, is flush Rebecca's line with this. Then I'm going to attach the end of the chemotherapy pump and I'm going to click start, and then that'll run for about an hour, and then there'll be half an hour after that when it will need to have the bottle of flush, and then hopefully that's Rebecca's chemotherapy all done and dusted for the day.